Hi everyone, my name is Kyle Dillon, and on behalf of the Registered Nurses Association of Ontario, I want to welcome you to today's webinar that focuses on engaging clients who use substances, a best practice guidelines initiative. This Nurses in the Know with RNAO webinar is one of the many resources made available by the Ontario Ministry of Health and Long-Term Care, and is hosted by the Registered Nurses Association of Ontario. I'm going to go over a couple of housekeeping notes before we begin today's session. Number one, we do have a chat box, which you can use in order to type a question or if you have a comment. Just to let everyone know that we will have a designated 10 to 15 minute period at the end of the presentation for questions and answers. If we are unable to get to your question during the presentation, our presenters have agreed to address these questions in writing, and they will be sent to everyone after the webinar. Also, just to let everyone know that we will be archiving and recording this webinar and posting it to our website, and that link will be sent out to everyone once it has become available. Access to the webinar slides and information about RNAO can be found in the file transfer window, which is located at the bottom left corner of your screen. All you have to do is maximize the window, and you should have two documents readily available for download. Momentarily, for reporting purposes, I will be administering a poll to get an idea of how many people you're viewing the webinar with. And I just ask that you take a quick moment to submit your answers for this poll. And I'm just going to be opening it right now. So once again, we just want to get an idea of how many people are viewing the webinar with you today. And I'll just give you a few moments to submit your answer. And just about 15 seconds left to those of you who have not submitted your answer. Great, thanks so much everybody. Now let me introduce our two speakers for today's webinar, Sabrina Morali and Tasha Penny. Sabrina Morali is the Program Manager for the Mental Health and Addiction Initiative at the Registered Nurses Association of Ontario's International Affairs and Best Practice Guidelines Centre. In her role at RNAO, Sabrina manages guideline development and supports the widespread implementation and uptake of best practice guidelines for nurses and the interprofessional team. Projects include development of the BPGs, Project Lead for the Youth Mental Health and Addiction Champion Project, and Project Manager for the multiple components of the Mental Health and Addictions Initiative. She is a registered nurse with a bachelor's with honors degree in health sciences, specializing in rural health from the University of Western Ontario. She also obtained her Bachelor's of Science in Nursing and Master's of Nursing from the University of Toronto, specializing in community health. Tasha Penny is the Manager of Research and Evaluation at the Registered Nurses Association of Ontario. Her portfolio includes supporting the Nursing Quality Indicators for Reporting and Evaluation, or NQUIRE team, overseeing the progress of systematic review, development, and supporting the Nursing Research Associates in their work, and managing the Advanced Clinical Practice Fellowship, or ACPF program. She is also a member of the Nursing Best Practice Research Center, NBPRC, and Sigma Theta Tau International Honor Society of Nursing. She completed a Master of Nursing at Ryerson University with a specialization in the health and well-being of communities. She has extensive clinical research, working with marginalized and vulnerable populations with major mental illness, and is certified by the Canadian Nurses Association, CNA, as a Canadian psychiatric mental health nurse. Welcome, Sabrina and Tasha. We will now turn it over to you for the presentation.
Perfect. Thank you, Kyle, and good afternoon, everyone. It is our pleasure to be here with you today to present the Engaging Clients Who Use Substances, the Best Practice Guideline Initiative. And again, our presenters today are Tasha Penny and myself, Sabrina, and we're both program managers with the Registered Nurses Association of Ontario, and we're actively involved in the development of this guideline. Trying to flip the slide. There we go. However, the guideline would not have been possible if it wasn't for the leadership of our dedicated expert panel, which is depicted on your screen right now. Our panel was co-chaired by Dr. Caroline O'Grady and Wayne Skinner, but had membership from across various experts of the continuum of care. And we want to send out a special thank you to our expert panel for their expertise, their leadership, their dedication, and their time and commitment to this topic area. At this time, we would like to disclose that the Registered Nurses Association of Ontario, in the production of engaging clients who use substances, had no conflicts of interest or any relationships with any commercial interests. The creation of this particular best practice guideline was supported by funding from the Ontario Ministry of Health and Long-Term Care. So today's learning objectives are really to support the description of the major components of the guideline development process, highlighting the process that we undertook in the development of the engaging client use substances best practice guidelines. We'll go through the major themes of the guideline recommendation, focusing in on the practice, education, system, organization, and policy of these guidelines, and to evaluate their impact on patient, organization, and health system outcomes. Since the establishment of the International Affairs and Best Practice Guidelines Center in 1999, we have currently 52 best practice guidelines, which cover the areas of clinical practice, healthy work environments, and are applicable to nurses and the interprofessional health team in all practice settings, including acute care, long-term care, home care, primary care, and public health. And other healthcare professionals, from those who deliver care at the bedside or in the community, to those working in administration, research, policy, education, and other areas of clinical practice. But before we start, let's review on what a best practice guideline is. So what a best practice guideline is are systematically developed statements based on the best available evidence at the time, whether it's qualitative research, quantitative research, or expert panel experience, to assist practitioners and clients in making evidence-based choices related to their health and their healthcare decisions. Every best practice guideline that RNAO produced has 3 types of recommendations. The 3 recommendations that we have are practice recommendations, what does the nurse need to do, education recommendations, what does the nurse need to know, and system, organization, and policy recommendations, which include what systems and policies need to be in place to provide an ideal setting to enable best practices. In today's presentation, in the Engaging Clients to Use Substances Best Practice Guideline, you will find all 3 types of recommendations. So the information we will be presenting today can be found in the Engaging Clients to Use Substances Best Practice Guideline that was released in March 2015. And the guideline has been developed to address the question of how to assess and intervene with people at risk for or with a diagnosed substance use disorder. The intent of the document is to assist all nurses and the interprofessional team to focus on evidence-based strategies within the context of the healthcare professional-client relationship. So let's start discussing the background on why this particular best practice guideline was created. So in 2010, the RNAO had released the methadone maintenance treatment best practice guideline. And while the guideline was being developed, the expert panel working on this particular guideline noted that a precursor guideline to the methadone maintenance guidelines needed to be developed on addictions. So we went to the literature and examined statistics to determine what the need and focus would be for this guideline. And it was clear that the prevalence, as you can see on the slide, was quite high. We know that in Canada, the 3 most commonly psychoactive substances used are alcohol, cannabis, and tobacco. And globally, the National Advisory Committee on Prescription Drug Use in 2013 reported that Canada was the second highest level of prescription opioid use, and our national prevalence rates of prescription opioids associated with substance use disorders were steadily increasing. Furthermore, although substance use can occur at any age, youth between the ages of 15 to 24 years of age are 3 times more likely to have a substance use disorder than individuals over the age of 24. It has been depicted that the overall cost in Canada for treatment of substance use disorders in 2002 was $39.8 billion, which includes not only costs for treatment, but enforcement, research, prevention, and the indirect costs due to loss of productivity. And it is only anticipated that this number was going to grow. However, there is hope, as evidence demonstrates that a significant morbidity, injury, and mortality results from substance use disorders can be reduced for future generations by implementing effective assessment, intervention, and prevention-based strategies. As such, the RNAO and our expert panel felt the need to create a best practice guideline to provide evidence-based recommendations to nurses and allied healthcare professionals on the assessment and interventions related to substance use and substance use disorders. So as the expert panel was creating this best practice guideline, the American Psychological Association released the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition in 2013. Our expert panel had many discussions on the title and approach to the guideline. Was it going to be an addictions guideline? Was it going to be a substance use disorder guideline or a substance use guideline? So while the panel was working on the guideline, the DSM-5 addiction and addiction disorder was further delineated and rephrased to be inclusive of substance-related disorders, which included substance-induced disorders and substance use disorders. So the panel felt that it really made sense to use the most current language from the DSM-5 as it is gold standard in the science of mental health and addictions. So further thought and considerations was given to this in the title of the guideline, and the panel further delineated that all individuals who use substances, regardless of a diagnosis of the substance use disorders, required support in decreasing risky behaviors for their substance use, should they wish to do so. Therefore, expanding the target population of the guideline to all those individuals who used substances. As a result, the expert panel adopted the definition of a substance use disorder found in DSM-5, which defines a substance use disorder as a cluster of cognitive, behavioral, and physiological symptoms indicating that the individual continues to use the substance despite significant substance-related problems. For this guideline, the term substance use disorder is used to indicate those at risk for problems associated with substance use, as well as those who meet the DSM-5 criteria for a substance use disorder. So the guideline is aimed to support and work with individuals across the continuum of use, from individuals that use substances to those that have a diagnosed substance use disorder.
Okay, thank you, Sabrina. So this is Tasha speaking, and I'm just going to continue on there with more information on how we actually developed this guideline. So the slide that you see right now, this is our framework for our best practice guideline program. So you see that top circle there, guideline development, and all the steps that go along with that. All of our guidelines begin with some sort of topic selection, which can happen in many different ways. A lot of times we are doing revisions of our guidelines because we aim to revise our guidelines every 5 years. Or sometimes our topics come from our members who say we really need a guideline on this particular clinical area. And other times there can be policy or governmental influence on our topic selection. All of our guidelines are informed by a systematic review, and I will go into that in the next few slides. Now, once the guidelines developed, at RNAO, what makes us very unique is that we also have a dissemination, implementation, sustainability plan that involves many different programs, as well as evaluation and monitoring. So the one to really note here is, I would say, the BPSO program. So our best practice spotlight organizations are those healthcare organizations that implement our guidelines. And then with Enquire, which is under the evaluation and monitoring circle, it's how those BPSOs then evaluate the implementation of those guidelines. So I just wanted to show that relationship to you very quickly before I move on. Okay, next slide. Okay. So Sabrina nicely outlined on slide 11, what the difference was between substance use versus substance use disorder and how the panel came to the decision on what to use. So that really did inform the purpose and scope of this guideline. So with all of our BPGs, they begin with a purpose and scope, so the reader has a very clear idea on who this guideline is for in terms of the healthcare provider, in what setting, and what clients that they are serving with this guideline. So for this one, it's to provide nurses and other healthcare providers across all practice settings with evidence-based practice, education, and organization policy recommendations related to the assessment and interventions of individuals. So in this BPG, it's 11 years and older, who use substances. Now, why we say who use substances and who may be at risk for or experience with substance use disorders, because we're quite aware that just because somebody is using a substance doesn't necessarily mean that they have a disorder, but we really want to capture both populations in this guideline. Okay, so guideline development. This is how we do it at RNAO. So I just went over the purpose and scope. The next step with our panel of experts is to develop clinical questions that will then inform our systematic review. So just so you know, and this is in the guideline, the clinical questions were, what are the most effective methods of assessment for substance use disorders for individuals aged 11 years and older? Second, what are the most effective interventions for individuals aged 11 years and older with a substance use disorder? So the first two get at our assessment and intervention. And then finally, what education and policy considerations may best facilitate nurses' care of individuals with a substance use disorder? Now, for the purposes of this guideline, we did have to narrow, our exclusion criteria a bit because there is such a wealth of literature within this topic. So we only looked at chemical-dependent substance use or substance use disorder, which means that we excluded non-substance use disorders such as gambling, addictions. We also didn't focus on specific pharmacological interventions. That was outside of the scope of this guideline. And we didn't look at tobacco-related or methadone maintenance treatment. And as well, we did choose to exclude concurrent disorders. And I think that people will have many different opinions on this, but it was really felt that considering the wealth of information on concurrent disorders, that itself could be a whole guideline on its own. And we were trying, with this guideline, to give nurses the tools to start that just initial conversation with a client coming through the practice who's using a substance. Okay, so once we've established, exclusion, inclusion criteria, the nursing research associates, who are our in-house research team, conducted the systematic review. Sorry, just trying to switch slides here. Alrighty. So whenever we start a new guideline or we're going to revise a guideline, we always begin with a guideline search. So from other guideline developers to see if there's been anything recently published on the topic that we're interested in. And the reason why we do this is because it really helps, for one, to see what's out there, but it helps us to refine our purpose and scope. So, to make sure it's not identical to something that's already been done. But it also really helps with the development of recommendations when there isn't enough evidence to support a recommendation, and or if the panel expert themselves have a specific opinion and it can be backed up by another guideline. So for this guideline, there were 5 selected that were going to inform our recommendations and discussion of evidence. Now, all of our guidelines undergo an agreed to appraisal. Now, I think in this instance, Sabrina can correct me if I'm wrong, it was the panel who did the agreed to appraisal, and Sabrina. And we do this different ways. Sometimes it's the nursing research associates, but we do like to include the panel because this is how they sort of get their feet wet, so to speak, in the topic. Now, with respect to our methods for the systematic review process, we do have more information available online, as you see the link there at the bottom of the slide, but I will go over just very briefly. So our search spanned from January 2005 to July 2014. And using our 3 research questions and coming up with search terms, we searched 8 databases. Specifically, we searched Medline, Cochrane Controlled Trials, Cochrane Systematic Reviews, Embase, PsycInfo, Database of Abstracts and Reviews of Effects, Applied Social Sciences Index and Abstracts, and then finally CINEL. We looked at specifically at adolescents, you know, between the ages of 11 and 18, and then of course also focusing on adults, so the population above 18 as well. We only looked at studies that were published in English, that was published in a peer-reviewed journal, and it had to include any healthcare setting or sector, and had to be relevant to the scope of nursing. We did include all study types. So, you know, for example, we included systematic reviews, RCTs, meta-analysis, but we also included other quantitative types of research, such as cross-sectional studies, cohort studies, and as well qualitative research studies. Now, in-house, our nursing research associates, when they undergo the systematic review, they receive the search results from the librarian that we work with at UHN. And they manage all of those citations in a program called EndNote. Once that's all put into the system, they each review all titles and abstracts of all the results, and they start screening out what isn't relevant. Then there's a second screening process where considered relevance review, where they look at the full text of the articles and again screen out even further, you know, based on the inclusion-exclusion criteria that was set by Sabrina and the expert panel. Once they have a core set of studies that are included, they extract data that's pertinent for the panel to know, quality appraise those studies using various tools. So at RNAO, we use a rating system of strong, moderate, weak, for example, so that the panel knows which types of studies to focus on. And then finally, they provide a synthesis, which we're now referring to as a narrative summary, and again, helps the panel with recommendation development. As you know, there's a lot of nursing research out there, so by the NRAs doing this, they can really synthesize the literature so that the expert panel can use it in their recommendation development work. Now, I think I covered everything there in systematic reviews. If you do have any further questions, let me know. But moving on with guideline development, once the NRAs or nursing research associates have completed the systematic review, so the data tables with the extracted information and the narrative summaries go to the expert panel. Now they meet here on site at RNAO for 2 days to review these resources and then start developing recommendations. Here at RNAO, our recommendations have 3 different types of categories. It's the practice recommendations, and I know Sabrina covered this. So that's what the nurse needs to do. The education recommendations tell readers what the nurse needs to know to, undergo the practice recommendations. And then there's the system organization policy recommendations that set up the environment for nurses to know and do. Now, recommendation development is really guided from the evidence of the systematic review, but I have to say it's also the expert opinion, because some of the topics that we have don't really lend themselves well to research. And in that way, we really rely on our expert opinion, so their past experience working in mental health and substances, as well as any of their own personal research. Now, once the recommendations have been developed and a first draft of the guideline is completed, it does go to stakeholder review. Now at RNAO, we do that, so it's a validation check, really, and it's another way to get further expert opinion or frontline opinion, which is very important, as well as patient experience. To see, do our recommendations, first, are they clear? Do they make sense? Are they realistic? They're asked various questions that they have to respond to based on the recommendations. Once we get the feedback from stakeholders, we then do another draft of the guideline to incorporate that. And then it goes to, final publication, so that's the hard copy, as well as the online version that is downloadable. So this guideline has actually been published, so in English and French, and that's paper and online. And then there's implementation resources that are also developed to go along with the guideline to help with dissemination and implementation. So, for example, that includes the app for the smartphone, our nursing order set, for those of you who are familiar with that, the health education fact sheets for clients, and then a manuscript that typically is a write-up of the systematic review. So again, just overview of our guideline. There's the 3 types of recommendations, but as well, you'll find a section in the guideline on research gaps. So when the NRAs are undergoing the systematic review, they do flag areas of further research that's needed that comes out of the evidence, as well as the expert panel also flags this. And we compile that information so that if, in future, if researchers want to take it a step further, that they have that information. We also develop indicators for evaluation. Now, when I went over the 3 circles, I mentioned NQUIRE. Now, actually, I should say NQUIRE stands for Nursing Quality Indicators for Reporting and Evaluation. Now, the indicators that are developed for the guideline is what the BPSO measures and then puts into NQUIRE. So you will see that in the back of the guideline. It's called Monitoring and Evaluating this guideline, I believe. Now, with all guidelines, we also provide appendices that provide practical tips and tools or any further resources that you need to know to implement the recommendations. Okay. So before we actually go into a summary of the recommendations, I just wanted to let everyone know that we did use 7 different guiding frameworks for this guideline, which is, I would say, quite unique for this guideline. Now, the reason why we did that is because all of this is so important, and we really could have probably made, individual recommendations on all of these. But to just sort of narrow the scope, we figured that it makes sense if we had the reader review these guiding frameworks and use it as a lens while they're reading and interpreting the recommendations. So the guiding frameworks we used was, of course, social determinants of health, which is huge here at RNAO, the population health promotion model, the trans-theoretical model of change, harm reduction, trauma-informed approaches to care, cultural competence and cultural safety, and then the recovery perspective. So if you're looking for any further information on that in the guideline, we actually written up some short blurbs about each one of those, and I've pointed to where you can get more information if you're not familiar. All right, now moving on to recommendations and themes. So if you've seen the guideline, you've seen this algorithm that Sabrina, myself, and a nursing research associate who actually works on NQUIRE and develops indicators came up with this. And I personally really like it. I think it's one of the first times one of our guidelines have created something like this. But we realized when we were reviewing the guideline and some stakeholder and panel feedback that there's definitely 2 different pathways that nurses can take, and it's based on their knowledge and experience. So you can see, I don't know how clear this is on the screen that you're looking at, but it's figure 6 in the guideline, and you'll see that the recommendations are all listed, and then there's the 2 pathways. Now, I know Sabrina's going to go further into that, so that's all I'll say about that for now. So before, Sabrina's going to look into that a bit further, but I just wanted to do a summary of the practice recommendations. So in total, we had 8 recommendations under assessment, planning, implementation, evaluation. So that's the nursing process that our guidelines typically follow. Now, the major themes that we identified was, of course, screening and assessing for substance use and related issues. But as well, it's very important to build that collaborative relationship with the client. And in this guideline, motivational interviewing was a huge part of that. Involving clients in their care, development of their plan of care, also very important. And then as well, how to intervene to support clients where they're at in terms of, whether they're ready to change or not. So where they're at in terms of change theory. So one of the other interventions that we really promote in this guideline is brief intervention. And we also, with respect to treatment, refer to combined pharmacotherapy and psychosocial intervention. So, as I said, one of the exclusion criteria was looking at medication to treat, substance use disorder. But it really came out in the literature that what's important is that when you are going to provide any sort of, medication treatment, that it should be combined with psychosocial intervention. So that's a recommendation supported by a high level of evidence. And then, of course, there's the evaluation piece of how do you evaluate the plan of care until the goals are met. Hi, Sabrina.
Perfect, Tasha. So thank you. So I'm going to walk you through the algorithm that can be found on page 30 or figure 6 of the guideline. And in this, there are 3 pathways that we'll walk through momentarily. What you're looking right now on your screen is pathway 1. And this encompasses screening of all clients to determine whether they use substances. It's applicable to nurses and other healthcare providers across all practice settings to initiate discussions regarding substance use. However, we should be mindful that prior to screening, healthcare providers must engage in reflective practice, which is recommendation 5.3, to identify personal values and beliefs that can affect the care of clients who use substances. So the first stage in supporting clients who use substances is to ask for permission and consent to discuss substance use. Should the client provide consent to discuss substance use, the expert panel recommends that nurses conduct an initial screening with all clients to determine substance use by asking the client a simple question of, do you use substances? If the client at this point states that they do not use substances, the expert panel recommends that the nurse and the healthcare provider provide health education teaching, positive validation for healthy behaviors, and continues to screen for substance use periodically, which should be negotiated on a time frame with the client. However, should the client identify with using substances that says yes to that question, the expert panel recommends that the nurse further screens the client using the 3 universal screening questions from Health Canada and or an appropriate screening tool to identify those who are at risk for or experiencing a substance use disorder. You can find more information regarding the 3 universal screening questions and a list of commonly used screening tools based on specific substances used, the client population being screened, and the clinical setting where the tool is being utilized within the best practice guideline. So what you're seeing on the screen right now is our pathway 2 and pathway 3. So once the initial screen is completed, the client may enter into 2 clinical pathways depending on the healthcare environment, client factors, nursing knowledge, and skill. Pathway 2, which is on the left-hand side, encompasses brief intervention, a plan of care, goal setting, and referrals to support. Minimal support required for all clients in any clinical setting across the continuum of care. Pathway 3, which is on the right-hand side of the algorithm, encompasses comprehensive assessment, plan of care, goal setting, interventions combining pharmacological and psychosocial interventions, and evaluation of plan of care. And this is applicable to nurses and healthcare providers who have specific knowledge, skill, time, and resources to work more closely to screen, assess, intervene with clients who use substances. Pathway 3 can occur in any clinical setting, but occurs primarily in mental health and addictions practice settings. This particular best practice guideline provides resources and tools for support, including a set of commonly used screening tools, key areas for comprehensive assessment, questions to consider when assessing the client's stage of change, considerations for high-risk and vulnerable populations, an overview of psychological interventions, as well as key considerations for sample-based prevention strategies, amongst other resources and tools.
Okay. Okay, so thank you, Sabrina. So again, that algorithm really does a nice job, I think, of visually summarizing our practice recommendations. So moving on to education recommendations. Really, there's three major themes that we found, through the literature as well as from the expert panel. One involving, undergraduate education for nurses, and then continuing education for nurses once they're practicing, as well as reflective practice, which we know is important. So what we really found through the literature, and I have to say this is supported by my own experience going through and not being able to get practice opportunities for those nurses and healthcare providers who are either interested in providing care to that population or not, but really need to have that information. Because no matter where you go in nursing or any type of setting or sector, you are going to come across clients who are definitely using substances at some point. Now, with respect to continuing education, there definitely is a need for opportunities for nurses to enhance their ability to assess and then work with clients, especially those clients who do have substance use disorders. And then reflective practice, I mean, all nurses should be doing this, but particularly in this area of care. It's to enhance current and evolving awareness, perceptions, and bias, values, and beliefs when working with this population. Okay, and then finally it brings us to system organization and policy recommendations. So the first recommendation here, advocates for improved health outcomes by increasing access to integrative and collaborative care for clients. So, at this point, we find that the care is quite disjointed, and it's really hard for clients to get the support that they need. And then, of course, reducing inequities by dedicating resources to prevent, treat, and support recovery of individuals. So this really has to come from a systemic level if we're going to make any great impact. And then at the organizational level, the recommendations focusing on advocating for your organizations to have more of a harm reduction approach, as well as integrating the social determinants of health in all care settings, because that really lays the groundwork for this type, dealing with this type of population. Also, we really strongly advocate in this guideline to integrate prevention, assessment, and treatment for clients using substances across all care settings, because as I mentioned before, they're everywhere. They're in the merge, the dentist's office, wherever clients are showing up to provide care, there is the opportunity for you to ask them about using substances. And then finally, our recommendations focus on knowledge translation processes and using a multifaceted approach to integrate best practice in terms of assessment and management. And then, in terms of RNAO, that second circle there of our implementation and dissemination activities is a really nice way to do that if you are a BPSO or planning to be a BPSO. Okay, implementation resources.
Thank you. So to support the integration and sustainability of this best practice guideline, we developed resources to support the integration of best practices across organizational settings. And these include smartphone applications that consist of condensed versions of this best practice guideline, and this will be launched in November 2015. Health education fact sheets to support client education, and nursing order sets, which are clear, concise, actionable, evidence-based recommendation statements that can be readily incorporated into various practice settings. So the RNAO Mental Health and Addiction Initiative aims to increase the capacity amongst nurses and other healthcare professionals to implement and sustain evidence-based mental health and addiction best practices in all settings and advocate for organization, policy, and system level changes. And the way we do this is through knowledge generation, which is on the left-hand side of the model, through the 14 best practice guidelines that are specifically related to the care of clients who experience mental health and addiction issues. We support dissemination of best practice guidelines, which is in the circle on the left-hand side, through tools such as the condensed version of the guidelines for smartphone applications, client health education fact sheets, and nursing order sets. We build capacity amongst nurses and healthcare providers, which is in the circle on the right-hand side, through our champions workshops and networking, supporting our best practice spotlight organizations in implementation of these guidelines. Our mental health and addiction institutes, we have one coming up in November 2016. And we also work on projects that look at some of the gaps in knowledges and resources within, that have been identified in the guidelines. So for example, we are currently working on developing a resource to support the integration of mental health and addiction best practices into undergrad nursing curriculum based on the CAUSN entry to practice nursing competencies for undergrad nurses across Canada. Another project that we've been working on is to support youth mental health promotion through implementation with public health units and district school boards across Ontario to work on using youth engagement principles in mental health promotion and the development of implementation resources to support best practices for uptake on youth mental health promotion. For more information on the Mental Health and Addiction Initiative, please visit www.rnao.ca/mental health. So when we started creating best practice guidelines in 1999, the next question that came about is how do you implement these best practice guidelines? So what you see before you is a toolkit developed on implementation science and specifically talks about how to implement guideline recommendations into your personal, your professional, and your organizational settings. If you are interested in implementing a particular recommendation from this guideline, we highly recommend that you refer to this tool for tried, tested, and true implementation resources to support you. To support continuing education for nurses across the continuum of care, we have developed e-learning resources. In particular, e-learning resource number 2 on your screen and number 3 on your screen are particularly related to the recommendations found in this best practice guideline. Our e-learning resources are free to all nurses and healthcare providers, take approximately an hour in length to do, and produce certificates of accomplishment at the end. However, if you are interested in more detailed information, more jumping into the actual toolkit of implementation of science, as well as to the best practice guidelines, we would recommend you to attend our free RNAO Addressing Substance Use Champion workshops, which are based on the Engaging Clients Who Use Substances Best Practice Guideline. We offer these workshops addressing substance use at both level 1 or foundational knowledge and a level 2, an advanced knowledge level. We have 6 workshop sites scheduled from October to January of this year and have already commenced, as you can see on the screen in front of you. However, if you are interested in hosting a workshop in your local community with your organization, please do contact Kyle or myself for more information. The Mental Health and Addictions Initiative also hosts monthly webinar series in partnership with the Opioid Resource Center, or Opioid Resource Hub, and the CAMH Health Promotion Resource Center. This month, we'll be hosting a webinar on November 24th with Mind Your Mind on their new substance use module for youth. We hope you can join us as well. And our final dissemination and implementation strategy is our RNAO Mental Health and Addictions Online Community of Practice, which is a virtual community for nurses and other healthcare professionals to provide support and networking and ongoing dialogue regarding implementation of guidelines and supporting clients with mental health and addiction issues. If you are interested in this, please do join our RNAO community of practices. It is free to join. And I'll turn it over to Tasha for some final areas.
Okay. All right, so I mentioned earlier in the guideline that we do have a section on research gaps. So just quickly, the focus of future research is in, it's broken down by practice, outcomes, and health system research. So we really found that there needs to be more studies there on primary prevention strategies and screening instruments, as well as the validation of screening tools and intervention options specifically for older adults and diverse cultures. Now, with respect to outcomes research, there needs to be more literature on effective educational programs and practical opportunities for nurses, as well as, the effectiveness of formal versus informal intervention. So, the formal intervention being led by a healthcare provider versus peer-led, which, Alcoholics Anonymous would be an example of that. Then with respect to health system research, we need accessibility to and utilization of substance use management services, so research on that, as well as effective care delivery models. Now, an interesting thing that came up was, whether government taxation on interventions for reducing alcohol assumptions and associated issues is actually an effective means. And then, what is the impact of social determinants of health on recovery?
So again, just to conclude our webinar for today, our Engaging Clients to Use Substances Best Practice Guideline is both available for free for download, both in English and French, and for purchase in a hard copy. We hope that today's webinar has provided you an overview of the guideline, and we will open the discussion boards now for questions and answers.
So thanks so much, Sabrina and Tasha. That was fantastic. Like Sabrina had mentioned, I am going to allow for a Q&A period at this time. So feel free to type into the chat box. Just make sure that you're selecting the All Participants option in the drop-down menu there. That way we can facilitate more of a conversation with the rest of the participants.
Perfect. So thank you, Judy. The question is, why exclude concurrent disorders? Mental health are flip sides of the same coin. That's an excellent question. So one of the things the ESTR panel did really look at was this issue of concurrent disorders. And what we found was that, the literature did not specifically look at concurrent disorders because there's a specific different literature set that would be respective to concurrent disorders. And the second thing is that concurrent disorders, truly to be responsive and respectful of concurrent disorders, really needs a guideline of its own. So that was a recommendation moving forward that concurrent disorders should be its own guideline because of its different nature in working with that particular population. Second question from Catherine, can we request a hard copy of the BPG? Absolutely. Please email Kyle and we'll get that sent out to you. Thank you. And Dana, I agree that CPG is absolutely a first stepping stone. I think what's really important is to be able to implement the CPG across clinical settings, irrespective if you work in primary care, public health, acute care, all the way to long-term care and mental health addictions and rehab. Thank you.
Do we have any further questions?
Absolutely, useful in forensic nursing. Thank you, Nancy.
And just a few more moments for you to type out your questions in the chat box. While you're typing your questions, I will just mention once again that we do have the file transfer window that's in the bottom left-hand corner of your screen, and that will give you access to a downloadable PDF version of the PowerPoint for today. If you weren't able to, if you joined late or perhaps missed something, those are available for you, as well as some information about RNAO and our organization as a whole.
The question from Amy, the Addressing Substance Use Champion workshops are a full day-long workshop because we look at the guidelines as well as implementation toolkit, and we do that concurrently, like we do that together. Given that, no, the workshop cannot be done in a half of a day. If there is time limitations, I do highly recommend that looking at the e-learning modules would be very helpful. The next question from Louise, can this best practice guidelines be shared with other disciplines, medicine, and government? Absolutely. And they are quite aware as we actively promote the guideline, but we do need your support in actively promoting it as well.
Okay, so there's a question here from somebody asking with respect to Enquire, is there a data dictionary developed, meaning the indicators? So no, not yet, but it is definitely on our high list of priorities of indicators that do need to be developed. Thank you for asking.
With respect to the smartphone app, you don't have the option to download the PowerPoint?
It will be sent via email to everyone with the evaluation link at the end.
Perfect. And from Grace, you're a new graduate. Congratulations as an RPN. And you are looking at regarding taking a substance use or mental health course or workshop. There is a appendix at the back of the guideline, Appendix M, as in Mary, that will provide you further support as to where you might want to look for further clinical education. Maxine, you're implementing the program on a Suboxone treatment, community-based Suboxone treatment program, and you want to suggest how we can use these guidelines. Are there specific areas you can focus on? Absolutely. I would look at the algorithm and look under screening as well as pathway 3 on how to engage clients. If they are using treatment, what kind of interventions could help be supportive? How do you develop a plan of care with the clients? How do you reevaluate that plan of care? And there's questions within the guideline and the guideline appendixes that can help you support you on that. Should you have further questions, Maxine, please don't hesitate to contact me and or Kyle, and we can absolutely help you out with that. From David, is there a guideline that exists or plans for future guidelines that can give any interventions for families dealing with substance use? What an excellent idea, and there is a little bit section in the youth recommendation 3.3, I believe. I'll double check that, but that does talk about youth and how to integrate family within their care. 3.3, wow, I was right. David, there is also supporting family through expected and unexpected life events, as well as our person and family-centered care guidelines that can help you to do that as well. Claudia, are there any guidelines in substance use and mental health? We have about 14 different related best practice guidelines for substance use and mental health issues. If you go to our website, rnao.ca/mental health, under the circle where it says best practice guidelines, if you click on that link, you can see all the best practice guidelines that we're talking about today. Do you have plans for a guideline in forensic nursing? Nancy, at this moment, no. However, if you have ideas, I'd most welcome them. Please do email me about those. We do plan that this particular guideline itself was responsive to nurses across the continuum of care, but we've been most interested in hearing other topic areas that you have. And Dana, absolutely, the e-learning modules are available to anyone who wants to do them. You do not need to be an RNAO member. And Kyle responded to that already. Thanks, Kyle.
Okay, so at this time, I don't see any more questions. And that brings us to almost 1 o'clock. We made great timing. If there were any more questions, we will actually, I'll go through the chat, and I'll speak to Tasha and Sabrina, and I will email those questions out with the answers for everybody. I know that we probably didn't have some time to address a few of them that we may have missed. So I did just want to mention that I will be sending out an evaluation. If you could please fill that evaluation out. We do welcome feedback, and we use that feedback in order to improve these webinars. And with that, I will say thank you to all, and have a great afternoon.